Journey Colab believes the formula for addiction treatment is psychedelic medicine plus therapy plus community support. In our interview, we discuss how their stakeholder model, which includes a purpose trust they cannot touch, combined with an open dialogue with Indigenous communities from day one, led them to evaluate the unique potential of mescaline for alcohol use disorder that everyone else had overlooked. Joined by Jeeshan, Chowdhury, CEO and founder of privately held psychedelics-focused biotech company Journey Colab. Welcome.
Thanks for having me, Nicole, and thanks for getting my name right. I appreciate you going through all the practice with it.
You actually have two L's, so it's more like Nicole.
Nicole. Okay. I'll work on it myself.
I'm just kidding. Okay, so Journey Colab, you founded in 2020. Big news for you at the end of last year, $12 million that you secured for your Series A funding, and that's to start your first human trials in 2022. So let us know, what's the focus of those trials, and early Q1, where are you now?
Great. Yeah. Overall, we're focused on unlocking the science of psychedelics to build a whole new model of addiction care, combining the potential of neuroplasticity promoting therapeutics like mescaline with psychotherapy and community support. Our lead program is mescaline, which is one of the natural occurring classical psychedelics for the treatment of alcohol use disorder. And this is, for an indication, and we talk about indications, but really for patients who are in desperate need of durable remission from this chronic and relapsing condition. And so, our focus this year is on building on the first modern data set in mescaline, which is really exciting. Like, mescaline was actually the first psychedelic known to Western science. The history of mescaline goes back many thousands of years. I think the earliest archaeological evidence of humans using mescaline is 5,700 BC. We have a long tradition in the United States of indigenous communities using mescaline. And despite all that, this is the first studies that we are conducting since the 1960s on this very unique psychedelic in the psychedelic toolbox, and doing the first industry sponsored human trials in mescaline this year.
Yeah, when is that happening? Is there a timeline for you right now?
We're working towards working with regulators, getting through our IND enabling studies, and we'll be dosing our first patient this year.
Fantastic. And what makes mescaline in particular ideal for those who are recovering from alcohol use disorder?
Yeah, that's a great question. A lot of people don't know about mescaline, and I'll actually maybe take one step back from you, and even though how we got to the choice of mescaline, we're set up as a stakeholder structure where 10% of our founding equity is put aside in a irrevocable purpose trust, and I use those words specifically, irrevocable, in that we can't take it back. It means that now it's in ownership of that trust, and purpose being that it's led for the purpose that we have defined, or we've worked with community defined. One being in reciprocity back to the land and the people the medicine comes from, and also looking forward in terms of the new models of care that we think are possible with psychedelics, and what we think is a healing economy where psychedelics are working with local centers and local operators to create a vibrant healing economy around this very, very important indication and unmet need. And I say that in that allowed us to create a space of dialogue where we could speak with elders in the psychedelic space, create dialogue with indigenous communities. And I think Michael Pollan says this best in his book, Your Mind on Plants, is that mescaline was the one that I'm paraphrasing here, is all the grandfathers and hippies held for themselves. It wasn't something that the industry looked at, but because we from the beginning started with that structure, we were able to have this dialogue with those communities, and we're able to understand the unique properties of mescaline. Mescaline is very interesting in that it's the only phenethylamine in the classical psychedelics. It's actually closer to MDMA than, say, to psilocybin, which is a tryptamine. Many people call mescaline more of an empathogen than in the psychedelic. And when we look at both the traditional use of mescaline, what we're seeing now with the rigorous scientific understanding of the mechanism of action, and the clinical studies, that these long-acting psychedelics like mescaline offer a unique advantage. And so I'll start off with the traditional data that we have been inspired by, and that we know that traditional communities in traditional settings have used mescaline-containing plants for hundreds of years to deal with addiction. And in fact, in communities that have been disproportionately affected by addiction in response to individual and systemic trauma. The use of mescaline-containing plants combined with therapy and community support is very clear in those communities to be one of the only effective treatments for alcohol in their community. So we have a long history that we're a real world evidence that we're basing that on in terms of the traditional practice. We're now understanding that long acting psychedelics like mescaline actually open up a longer period of neuroplasticity, and actually the work of Gold Dolan at Johns Hopkins is showing us that we actually even know more specifically, because we talk about neuroplasticity as this general thing, but it's very interesting that her work in rigorous animal models showing that the psychedelics work by opening a period of relearning, very similar to when people think about relearning periods. You can think of when a child is able to learn a language very easily and with an accent versus us trying to learn it as adults, much harder. So we know we have these periods of relearning, critical windows of learning, and psychedelics can reopen these periods. And it's very clear now from the scientific evidence that the longer acting psychedelics like mescaline open this period for not hours like ketamine but actually weeks. So we're seeing a longer period of neuroplasticity, or a longer period of relearning, which lends itself to chronic condition like alcohol use disorder, where we're trying to achieve behavior change. And then when you combine that with what we're seeing across the evidence, in that it's when psychedelic medicine is combined with therapy and combined with community support that we see the strongest effects. And in the treatment of alcohol use addictions generally right now, we see those two components. We see a strong tradition of therapeutic communities, a strong tradition of therapy and community, but what's missing is this last piece about starting with the brain first and starting with an agent that opens this period of relearning or this critical window for a longer period of time. So that's a very long-winded answer to your question, but both from what we've seen through traditional use, what the science is telling us now, and what we see very clear from the clinical evidence, mescaline has a very strong potential to be able to meet the needs for chronic remission in this very debilitating disease.
Absolutely. Wow. I mean, I really, really appreciate being taken on that journey with you through your brain. And it's clear that you're very passionate about this. You're going to be an absolute nightmare to transcribe, but I'll let you know how long it takes me for that part alone.
I'm trying to cram a lot there in a short period of time, but happy to slow down and expand. There's a lot here.
Yeah, there's a lot. No, it's totally fine. Please don't hold yourself back. You are trained as well in psychedelic assisted therapy, correct?
Sorry, I lost that last question.
Oh, I was just saying you're trained as well in psychedelic assisted therapy yourself.
Well, I'm an MD PhD by training. I did medical school in Canada. I was very fortunate to get a Rhodes Scholarship and went to Oxford and did a master's and a PhD there. I actually, much to the chagrin of my immigrant parents, I dropped out of residency to start my first company through Y Combinator, and then came to psychedelic medicine through my own mental health journey, and after seeing firsthand the effects that we can see with psychedelic medicine when it's combined with therapy and community support. I'll keep coming back to that. Spent actually, before even starting Journey, spent 2 years talking to over 300 people in the psychedelic space, and part of that actually also took the CIS course, which is one of the only academic courses on psychedelic medicine. It's actually the certificate program in psychedelic training and research. And as part of that, we were able to receive training from the first two parts of the MAPS training. We had Mary Costumano, Bill Richards, all the team from Johns Hopkins talk about the psilocybin training, and even had people like from the Polaris Institute talk about ketamine. And that I've always felt as a physician, it's important to understand both ends of the stethoscope here in terms of understanding what do providers need, as well as what do the patients and family need for us to be able to have access. And this comes back to us in that we need safe and effective treatments that can scale.
And I do love that you keep referencing community, because that's really important, is to have those people that you can lean on when times do get tough, right? So you don't revert to old behaviors, because that might be where you found so much of your sense of identity before. So I really do appreciate that you're bringing that up.
Absolutely. I mean, we're seeing time and again, every single study that comes out where you try and cut out therapy, where you try and cut out community support, like we do not see the unprecedented and groundbreaking data that MAPS has shown with their very robust, not only studies, but also programs of combining psychotherapy with psychedelic, supervised psychedelic experiences. And I think that as we get, I'm a scientist, I'm also a physician, like as we get more and more clinical data, as we do more scientific inquiry, we're going to see this consistently being reinforced that what we know from traditional use is that the medicine, as it always has, works in the therapy, in the context of therapy and community. And what I was talking to you about earlier, this mechanism of action around the opening critical periods or creating this period of relearning. What are we relearning to? We are relearning to the context and environment around us, and that's why the therapy and the community that you're around is very important. And addiction is a complex disease, and our reductionist views around addictions, quite frankly, just have not worked, and we are continuing to fail our patients and the families around them. And it's not just the patients. It's the families, it's the communities around them. The economic impact is huge, and so having this integrated view to addiction is absolutely necessary. It's not only the safe way to go; it's also the effective way to go. And again, I think that often at Journey we feel like we're somewhat alone in this perspective. Unfortunately, it's surprising that it's become a contrarian view in a lot of ways in the psychedelic space, and I think that's because of who we are. Because we are the stakeholder model, because we create a space of dialogue with where this medicine comes from, and in addition to where it needs to go, we can take this more integrated perspective.
And I want to talk about that a little bit as well, because you refer to yourself as almost this unique company, or at least you have a bit more of a unique model. And part of that is this reciprocity trust that you have, and this 10% founding equity is dedicated to, you had said, Indigenous communities and support. Is this a gap that you're seeing in current psychedelic companies for the most part, where it's not necessarily baked into their business model that they have a reciprocity program? It almost seems like a bit of an afterthought.
I think that I'll tell you my perspective as a founder here. I would be negligent in trying to create any product and service and not include and learn from the only people who have done this at scale, who have done it safely, and who have done it effectively. No matter what product you would be doing. My last company was a software company. I would be negligent if I didn't talk to the only people who knew how to do it. And so I think that it's a business decision for us to create a space of dialogue with those communities, for us to be able to learn from each other. It's not charity. It's not window dressing. It makes us a better company and helps us make better decisions. Like I told you, we were able to uncover, I'll be careful on the rules, we were able to learn the potential around mescaline because we set up that company. We've set up Journey as the stakeholder model, created that space of dialogue, and understand the unique potential of mescaline that everyone else had overlooked. And so all I can say is that it is, to make the best decisions in this space, it is, at least from our perspective, incumbent to create that space of dialogue with those communities. And that's the communities where this is coming from, and this communities where it's going to, in terms of the therapy communities, the therapeutic community, the therapists, the therapeutic communities, the physicians that will also be involved in this. And the Journey Irrevocable Purpose Trust is to support both of those. And we're very proud that we actually have an Afro-Indigenous health advocate, Sutton King, who's on our team, who will be leading the trust. And so this is about actually putting ownership in the hands of those communities. And when those stakeholders are true owners, that's where you see true change. Because I think the pledge of future profits is nice. Is a nice thing to say. I don't know how we be accountable about that, but what I do know is that investors want ownership. They don't want royalties for a reason, and that extends also to other. That's what we want as employees. That's what we want as founders. Why would we not extend that more inclusive form of capitalism to these other stakeholders as well?
You had also touched on almost what was referred to as like a bit of a controversial question, and I think it is an important question. And I wanted you to just pick up where you left off before we started recording. You know, I don't know anybody who's listening might believe this or not, but I asked him a question ahead of time, and he just started talking and talking and talking. I was like, no, wait, save it for when we're recording because I think this is really important. You asked, you know, given the opioid crisis, like, can we trust the same structures that got us here? Can you elaborate on what you meant by that?
Yeah, we are working with incredibly powerful class of compounds, psychedelics, and you know this is shown in the unprecedented results from groups like MAPS. You know, when you combine this with therapy and community around that, we're also in a time where we are in the shadows of the opioid crisis. Again, another powerful class of psychotropic compounds, and I think the question that we all need to ask is: can we trust the same incentives, structures, and governance that led to Purdue Pharmaceuticals, whose mission was to solve pain? Their mission was to solve pain, and we see what, and you know, we can look into whether it was unintended or not. But you know, the aftermath of that and the tragedy around that, I think psychedelics are coming right in the shadow of that, and I think we need to ask the question of, you know, particularly companies that are creating new psychedelics, companies that are only you know, we're a for-profit company, but you know only have like one shareholder involved. Can we put our trust in those structures, incentives, and governance models in the shadow of the opioid crisis? And you know, our perspective is that we want to be able. Our mission, you know, is to you know, provide durable remission solutions for durable remission around addiction. And we find the safest way for us to do that is to have this stakeholder model where we have multiple stakeholders from where the medicine comes from and where it's going at the table with us to ensure that we are a safe and responsible and ethical steward in developing this, because we do still at the same time need to develop these. The need is urgent, and the need to translate, you know, what we see in traditional communities and what we understand in the science and the clinic is an immense need. But we feel that we can do that responsibly and safely, and are an organization that you can trust because of the stakeholder model, particularly with the population we're talking about in addiction, where the patients and the families have suffered enough to not have putting safety, efficacy, and responsibility first.
And Jeeshan, what should investors be looking forward to for Journey Colab in this coming year?
You know, we're continuing to grow out our team, continuing to do our, you know, rigorous building out our proprietary rigorous data set, modern data set around mescaline, and then moving into our, you know, first in human trials. And so I think it's going to be a really exciting year for us in terms of taking, you know, the first psychedelic that, you know, known to Western science, and actually bring it into the modern era and have it be a unique offering in the psychedelic tool class of compounds and tools that we are developing.
Thank you.
Thank you.